Welcome to Adapt NCLEX Respiratory Pharmacology Antihistamines, one of the common medications you will see on the NCLEX or day-to-day life. So you better know a little bit about it. Stick around and let's learn something on it. And that will help you solve pharmacology questions. They're very common. So let's get to it. As usual, this is designed to give you a quick note, quick information that you need straightforward. So antihistamines, there's different kinds. There's the H1 receptors, okay, and there's the H2 receptors. We're going to focus on the H1. The H2s are usually in the GI tract. The H1 is what we're going to deal with. So anti-H1 receptors, which are antihistamines, that's what they're going to react on. That's what we're going to focus on today. So what is that? H1 receptors, if you activate them, what are you going to see? That's the first thing you have to know. Pharmacology is basically pathophysiology. Based on the problem, you can figure out what you want to do. When you activate H1 receptors, you're going to have capillary leak. When they leak, what is going to happen? It causes edema and hypotension. That's the first thing. Second thing, they're going to cause the bronchiolar constriction. And this is what they give you airway issues, shortness of breath, right? The third thing they do is they cause nociceptors, basically activate pain receptors. So you have pruritus, and maybe pain. So these H1 receptors can cause hypertension, can cause edema, they can cause bronchial constriction, they can cause pain and pruritus, it causes itching. So the function of H1 blockers is to prevent all these things. So when you have blockage of these receptors, you're going to have what? Decrease capillary leak. So there's going to decrease leakage. So less edema. You're going to have bronchial dilation, right? Bronchiolar dilation. So that's why we use it in respiratory issue, and you will decrease itching. That's why antihistamine, antihistamine. So we prevent itching. Now let's go. So this is the why we're going to derive their function. Now let's go. What are you going to do? There's two types of antihistamines, right? In terms of H1 receptors, there's two. There's a first generation ones and the second generation. The first generation are like diphenhydramine, right? You already know them. This is Benadryl. Then you have meclizine. This is used for motion sickness. Then we have hydroxyzine. And the last one is promethazine. This is like Phenergan. What do you need to know about these first generation? They crosses the blood barrier. Therefore, they have central effect. They can have central effect. So what do we use them for? So usage is for allergies, right? We use it for allergies. We use this as a sleep aid. We can also use it for motion sickness. We can also use it for nausea and vomit. Because they go, why? Because they go into they crosses the brain blood barrier, and so they causes sedation. This is the main reason why we can use this for sleep aid, and then also some nausea and vomiting affect the brain, so it causes adverse effect is sedation. So this is one of the adverse effects. Sedation is the biggest side effect of it, but you can use it for allergies, sleep aid, motion sickness, and nausea. Another big that you're supposed to know is anticholinergic. This has very, very big implication. Anticholinergic And so you have to think about situation, glaucoma, right? BPH, dry mouth, all these things. You don't even have to memorize. You can come up with side effects. So adverse effect is sedation, anticholinergic. It's used for allergies, sleep aid, motion sickness, because it crosses the brain barrier. The second generation H1 receptors. So this is the second generation. They does not cross the brain blood barrier, right? Therefore, no sedation. They have less anticholinergic effect. Okay. But what is the good thing? They are the best for allergies. So if you have allergies, you good, it's better to choose H1 receptor by second generation, which is what? Loratadine. You've seen it before. This is what we call Claritin, right? Or cetirizine. This is what we call Zyrtec, right? You know them. And then Fiso, this is my favorite, Fisonadine. And this is Allegra. They are the best for H1 receptors for allergy. If you want true allergy treatment, you better select the second generation H1 receptors. But if you want something that will help with the itching and other thing, and first generation is the best. And if you want to sleep with it, first generation. So sleep aid, allergies, motion sickness, these are all first generation. So these are some of the things you have to know. Of course, NCLEX is a safety question, safety test. So they're going to have safety issues, and therefore, nurse intervention, nurse teaching. What are you going to tell them? One, you should not drink alcohol, especially if you're taking first generation. Two, you should avoid SNS depressant if you're taking first generation, right? You should avoid it in an elderly patient because they're going to fall down. The sedation, right? Um, you should drink a lot of water because of the anticholinergic effect, constipation, dry mouth, and other thing, right? Drowsiness. You cannot drive. So no driving if you take it, right? You should also avoid cold medication. These also have antihistamines in it that will make you also sleepy, so you should avoid it. And the last one is caution. This is the NCLEX love this. They love this very much. So contraindication. So if you have glaucoma, yeah, you should avoid it as much as possible. If you have BPH, it can cause urinary retention. You should avoid it. If you have asthma or COPD, you should also avoid it because it can increase secretion. And asthma people don't like secretion. So secretion increase. So these are some of the things you have to know. Of course, the anticholinergic effect, dry mouth, right? Constipation, urine retention, pupillary dilation. So these are side effects of that. So this is the basic, simple, straightforward antihistamine H1 receptors, which are usually the respiratory problem. There's two types. There's a first generation, second generation. First generation mostly for itchiness, nausea, sleeping because of the sedative effect and the motion sickness. And the second generation are the true allergic medications that will make you deal with the respiratory problem if you have allergy. If you're trying to take something for itchiness, you should take the first generation, either diphenhydramine or Adalax. That's what we call it, hydroxyzine. Okay, antihistamine made simple. Take care of yourself. If you like this, share this video with your friends, and I see you later. Or subscribe to our um, YouTube channel for membership, and you get more of this. Take care of yourself. Good luck in your exams. Bye.